just a minute. Hello everyone, welcome to SCNM's webinar. We're very excited to bring you this interactive online experience that will let you learn more about what it's like to be a student at SCNM. My name is Eve Velotis and I will be the host for today's webinar. Before we begin, let me take a moment to familiarize you with the technology that we'll be using today. Hopefully you are seeing my screen and you're seeing a snapshot of the control panel. Make sure that the control panel is expanded on your computer. This is the tool that you're going to use today to actively participate in today's webinar. So there should be a box like the one shown in the upper right-hand screen. If you don't see this box, look for a double arrow. Click these arrows and your box will expand. You will have the opportunity to ask questions today. To do so, just type your questions into the box indicated here. Your questions will be answered verbally, and they'll be answered after the presentation is complete. We anticipate the webinar to run approximately 60 minutes, 40 minutes of presentation, followed by about 20 minutes of question and answer. Before we begin, we'll give you a brief introduction to naturopathic medicine. As many of you are familiar, NDs concentrate on whole patient wellness, attempting to find the underlying cause of a patient's condition rather than focusing on symptomatic treatment. NDs use natural therapies rather than synthetic drugs to treat their patients, and Alex will go over some of those therapies in her presentation. You can see the principles of naturopathic medicine on the screen. Of course, first do no harm, the healing power of nature, finding the cause, doctor as teacher, treating the whole person, and preventative medicine. During today's webinar, you'll be hearing from two current SCNM students, Guillermo Ruiz, a first-year student, and Alex Mayer, a fourth-year student. So you'll get a great perspective on what it's like to almost finish your education at SCNM, plus you'll hear from the perspective of a second-quarter student who just began his journey. First, you'll hear from Alexandra, or Alex. Alex grew up in Ontario, Canada. She began her journey to naturopathic medicine during her undergraduate degree in health sciences at the University of Western Ontario. At this time, she really found her passion for medicine and started researching various careers in healthcare to find the one that fit best. She knew that that was naturopathic medicine, and after beginning to see an ND herself, she knew this was the path she was meant to take. And of course, her journey led her to SCNM, where she's currently a fourth-year medical student, getting very ready to graduate. Then you'll hear from Guillermo. Guillermo was born in Texas, but came to SCNM from Florida, where he completed his undergrad. And he began his journey into the profession when his girlfriend's mom got sick. He really took it upon himself to start researching alternative therapies for her, and that really brought him into the profession. Guillermo loves SCNM, but jokes that he doesn't have a lot of spare time right now as a first-year medical student because he's always busy studying. Although every little bit of spare time he does have, he loves to read research papers. You know that makes him a really great medical student, and also loves to karaoke. So once again, thanks for attending our webinar. We hope you find this presentation both interesting and informative. And with that, I'll turn it over to Alex to talk about her experience at SCNM.
Thank you, Eve, for that introduction. So like you kind of mentioned, I'm going to start by going over a little bit of the basics of naturopathic medicine. So I know that probably a lot of you on the call will already know this in your research, but sometimes it's nice to get a first-hand view on things. So on the screen are the principles of naturopathic medicine. Eve kind of already went through a few of these, but I'm going to go through them in a little bit more detail. Basically, these are the fundamentals of what we do as naturopathic doctors. So first, do no harm is the basic principle in all of medicine. And it's the idea that you are not to harm your patient. And so you are always to pick the treatment that is most indicated, has the best results, and is safest for your patient. The healing power of nature is the next one. So in naturopathic medicine, there is something we call the vis, which is basically the ability of the body to heal itself. And as naturopathic doctors, we focus on supporting that and making sure that we trust its ability to help our patients through their journey to health. The third one is identify and treat the cause. So this is a principle that I find brings a lot of people into naturopathic medicine because it's more than looking at just a cluster of symptoms here and a cluster of symptoms there. You're looking at what's creating the symptoms. And so instead of having your patients have to be on a certain medication for the rest of their lives to control their symptoms, you can often find what's causing it and then change the course of their disease, which is really, really powerful. The next one is doctor as teacher. I would say that this is one of the main principles that sets us apart from other medical professionals. When you are a patient and you're going into a doctor's office for your 15-minute visit, your doctor can absolutely talk to you about diet. They can talk to you about lifestyle. They can tell you why they're putting you on the medication that they're putting you on. But realistically, in 15 minutes, the amount of education that you're going to get might not be enough to actually significantly impact your life. And so what we as naturopathic doctors find is that when you share and teach your patients how to incorporate things into their life and why your treatments work, they're more likely to do it and much more likely to be compliant because they understand how it's actually affecting their disease processes and why it's so important. The next, treat the whole person. And so with this, obviously, you are looking at your patient as a whole person. They're not a cluster of symptoms here and then a cluster of symptoms on the next day. You really need to look at everything that's going on with your patient. And then the last one is prevention. This is another reason why I feel like a lot of people get into naturopathic medicine because there's so many diseases that are perfectly preventable through lifestyle and diet changes and things like that, and we're just not doing that at this point. And, you know, if you can get your patients not to be sick, that's way better than treating them when they're already sick. So this slide kind of has an overview of some of the modalities. You know, you can read them on the slide. One of the main things that I think makes us very different is that in terms of nutrition, we have extensive nutrition training. And so you are getting many, many hours of nutrition because I already talked about being doctor as teacher. And if you don't understand what's going on in the body, then you are not going to be able to explain it to your patients, and they're not going to understand exactly what you're telling them. On top of that, we're learning physical medicine, we're learning environmental medicine, we're learning about herbs, we're learning homeopathy, we're learning hydrotherapy, we're doing IVs, we're doing acupuncture, and in the state of Arizona, we can also do minor surgery. I think the most important thing, and it's something that maybe I didn't realize as much coming into school, is that you are a physician. So in the state of Arizona, you are trained to be a primary care physician, and you end up graduating from school with the confidence to do so. And so that goes back to like the first do no harm idea. You know, sometimes when it comes down to it, you need to do what's best for your patient. And being able to do a little bit of the conventional treatment along with naturopathic treatment sometimes is where your patient's at and it's what they need. So the next slide, I just wanted to talk about practicing in Arizona. So what's important to realize is that Arizona does have the widest scope of practice, and that we can do things that other NDs in other states might not be able to. So these are a few of the ones that I came up with. So we do have prescription rights in Arizona. We actually have one of the widest prescription rights with the most amount of pharmaceuticals on it. And this is something that I didn't realize was important to me until probably halfway through my degree. And it's not because I plan on using my script pad every day in practice by any means, but it's because sometimes, like I said, standard of care is an antibiotic for certain conditions, and that actually is what is most effective. And then along with that, sometimes you have to meet your patient where they're at, and maybe they're not ready for full-blown naturopathic medicine, and so you need to be able to kind of bring them to bring yourself to where they are so that you can treat them and help them move towards health. Along with that, in Arizona, we can do acupuncture. We are licensed in minor surgery, and we can also do the physical manipulation aspect of it. So there's a lot of things that you can do just being here versus other states. So Eve kind of already introduced me, but I am a fourth-year student, and I am from Canada. And a lot of the questions that I get, one of the main ones is, why did I move all the way from Canada? And why didn't I pick the schools that are there? Because they would have been closer to home. And to be honest with you, I looked at the other schools, and I'm a huge advocate of going to the other schools and seeing them, because you get a sense of where you're supposed to be when you're there. Like, you get a feeling. And when I visited SCNM, I got that feeling. The things I needed to succeed was support, and I knew that about myself. I knew that to get through medical school, I needed a student body that helped me through, and there is a cohesiveness within our student body, and we are all in it together. And it's gotten me this far, so I guess it was a good decision for me. Along with that, the weather does make it a great plus. It's really easy to talk people into visiting you in Arizona, much more simple than some of the other places in the U.S. and Canada. So this is kind of a list of pros and cons that I think that everyone should think about when they're going to school. It's not necessarily what my pros and cons were, but what yours are. And so when I started, you know, Arizona does have a lower cost of living than some of the alternatives. It does have a great atmosphere, like I said, and a good student body. It taught acupuncture as part of the curriculum. And so for me, I'm probably going to end up either in Arizona or in Ontario, Canada, and both of those places allow me to practice acupuncture with my ND degree. And I've seen acupuncture work, and it's pretty amazing. And so that's something I definitely wanted to use, and I definitely wanted to have in my training. You start your clinical training in the first year of school, which I'll talk about a little bit later. And then I already mentioned the weather. The cons are that I'm far away from home. And when I started here, it was really scary to be a student in a different country, and honestly, I had no idea what that meant. And then financing my degree was a little bit tricky, but completely doable from Canada. It's just not as easy as if you're an American student. So being far away from home, basically the idea is you will miss stuff. Like, there will be life events that happen. Unfortunately, life does not get the memo that you're in medical school, and family members will pass away, and people will get married, and people will have kids. And throughout my few years here, I've had some life events that I've missed and I've been sad about, and I've had some that have just been that important that I've gotten on a plane the next day and ended up home for them. So it's totally doable. The other thing that I will say is that my family, like my SCNM classmates and my friends, have kind of become my family here, and so I don't get homesick anymore. And now that I'm coming near the end of my degree, I'm actually having the opposite problem, where I feel like leaving Arizona is probably going to give me as much heartache as leaving home did. So classes. So Guillermo is going to talk more about first year, and he'll give you a really good insight into what that looks like. So I'll kind of skip over that. So second year, what you're starting is your pathology classes. So you're starting to learn diseases and diagnostic criteria and things like that. And then you're starting your modalities. So you are starting to learn homeopathy, you're starting to learn nutrition, you're starting to learn Chinese medicine, and physical medicine, and things like that. So you're really getting into kind of the nitty-gritty of naturopathic medicine. And it's a nice change from first year, because first year is a lot of sciences, and so second year kind of gets you really, really excited about the medicine. Between first and second summer, you'll end up doing clinical observations. This was actually one of my best experiences at SCNM. I did my clinical observations in the summer of second year, and I did it with a doctor who does a lot of women's medicine. She's also a midwife, so she does a lot of women's medicine and pediatrics in her office. She let me do a lot, I saw a lot, and it really inspired me. Like right now, I probably will focus on women's medicine when I graduate, and I think a lot of that was because my clinical observations were such an amazing experience. Moving on to third year. So third year, you're continuing classes. You're continuing classes your entire career at SCNM. But in third year, you're adding your clinic shifts in, which is nice because it's a good way for you to integrate the material. And then fourth year is kind of the same. Now, what I will say is that when you go through school, you end up kind of having heavier classes at the beginning, and then they get lighter as you go through school. And I will say that the workload gets easier, not because you're doing less work, but because you have such a good foundation of knowledge that things come easier and connections come easier. And so it's much less difficult as you get to the end of school. On top of that, you're doing your clinical training the entire way through your education. So in your first week at SCNM, you're starting to take blood pressures, and you're learning how to do intakes, and you're learning how to like read cases and come up with some diagnoses maybe that you would give that patient. And what's really important about this is that when you are in your basic sciences, first of all, it's really easy to lose sight of what you're actually doing. And second of all, it inspires you to kind of realize what you're in school for. Along with that, my class was the first class going through the new curriculum, and one of the some of the feedback that we got when we entered clinic was that we were significantly more prepared than the classes that came before us because we had been doing our clinical practice for so long before we actually started clinic. So now we'll actually talk about clinic. You start clinic in third year, so in quarter 8, and basically you start with a couple clinic shifts, and then you work your way up until 5 clinic shifts a quarter. It's a really great way to get hands-on experience, and it's a really good way to integrate the information that you're learning. So the way it works is there's usually a primary and a secondary student. The primary student is the one that's interacting with the patient. They're the one who's taking the case. They're the one, like that is their patient. The secondary student is there to help out. They're mostly observing, and then usually at the end of the visit they do have an opportunity to put some input in. And then they also do have input in the treatment plan process. What I will say is that theoretically, you start as a secondary student in third year, and then you go to a primary student in fourth year. In reality, that's not actually the way it works. And so sometimes you're a primary student in your first quarter in clinic, which is great because it's a good experience for you, and the sooner you start, the better, right? The doctor is really there. They're facilitating the process. So they're facilitating your learning by pushing you maybe to ask questions that you didn't think of, things like that. But then they're also there to help you determine, you know, what labs and imaging you would run, what differentials you maybe didn't consider that you need to, and helping to make sure that you're developing a treatment plan that's solid for your patient so that they're going to feel better. The other thing that really is quite common in clinic are patient write-ups. And so what happens with this is when a new patient comes in, they usually, on some shifts, they won't get treatment that day, but they'll get treatment the next week. And so the reason why they do this is because then when the patient leaves, that week your entire shift will work up that case. And so you're reading through the case. You're coming up with diagnoses and reasons why you do or do not think that that is an appropriate diagnosis for that patient. You know, coming up with labs and imaging so that you can rule in or out whatever differentials you're thinking of, and coming up with a treatment plan. And what's nice is that this isn't, because it's not done on the fly, you can really sit and do your research, and you can really think through your process of being a doctor. And then the next week on shift, you'll go back and you'll discuss it with the rest of your shifts and get feedback. And so it's a good way to practice without it being necessarily like you have to come up with it in 10 minutes kind of thing. So I wanted to put in this slide because I'm a very big advocate of creating your ideal education. So I think what you have to realize is that SCNM does a great job of creating a really strong framework for learning. But I wanted to get as much out of school as I could while I'm here. And so for me personally, and I tell this to students all the time, if you want information or training in a certain area and you feel like maybe you don't know something or you wish you did, then you should go find it. Our community, our ND community, is amazing at supporting people and giving them opportunities to learn, and so that's something to know. So basically, the more experience, the better. So you should go shadow. And when I say shadow, I don't mean shadow just NDs. Like, I went and shadowed a DO who does women's medicine, and although his treatments were really different from the treatments I might give my patients, it only made me more able to talk about, A, the alternatives to what I would give, and B, to understand why my patients, what my patients are going to come in on, or what treatments they might have tried. And it gave me a good experience to talk about naturopathic medicine with other people. You should network with doctors, again, not just with NDs. You should do office visits. So, you know, the clinic at SCNM is great, and it's a great learning experience, but in terms of being the most functional clinic in the world, there's a lot of clinics that are run really differently, and when you're in private practice, running a private practice is a lot different than running a clinic with 30 doctors in it. And so you have to go out and see that to be able to do that when you graduate. And you should ask questions. So I also put in this slide because you have to realize that medical school is about balance, and you have to have a life on top of school. If you don't, you will burn out really fast. And so things in Arizona, I mean, we're 2 hours drive from a lot of really great destinations. We go hiking. We also went skiing for a weekend. I learned that you can ski in Arizona. We do game nights. We do family dinners. We go camping. You know, we have fun, and I think that that's really, really important when you're in school. So preparing to graduate, it's hard to believe that this slide is even on my PowerPoint because it goes by so fast. So first of all, residency versus private practice. I think a lot of people have questions about this. You know, there are people in my class that they love to teach, and they feel like they want more experience kind of with somebody else helping them out before they go out into private practice. Like, they just don't quite feel ready. And then there's other people who are completely ready, would not even consider a residency, are absolutely ready to hit the ground running, and that feel like they can go out into private practice and be successful. What I think is the most important thing is that I will tell you that residency or no residency, I definitely feel ready to go out and see patients, and I feel like I have the resources and most of all the support to be able to do so. So, you know, at this point I know that I don't know everything, but I know that I have a lot of really great doctors on my side, and I know that I can call them if I need to, which is really important. Along with that, I've been working on some things outside of class, mostly for business. You know, I think that fostering your business sense is super important, and NDs are not doing well because they are bad doctors. It's because their business sense maybe is a little bit lacking. So I've been working on determining what my target market is going to be, what my specialty is going to be, working on my website, and all of those things, because you have to do that. I'm trying to decide where I want to be after school. It's a difficult decision, especially when you're in such a good scope, because you have to kind of determine what is important for you clinically and what you're willing to give up, maybe to be closer to home. And so it's not necessarily super black and white. So Overall, I will say that my decision to come to SCNM was definitely the right decision. I think that moving away from home challenged me to grow in ways that I don't think I would have if I was closer to home. And along with that, I was able to focus on my school because everybody around me was kind of in the same boat. You know, if I was at home, I would have ended up probably, you end up having two lives, you know, and one of them is a non-school life, and so I think it makes it almost a little bit difficult to focus. Along with that, I got a great education at SCNM, and I feel like I'm definitely prepared for when I graduate, and that's what's most important. And I think what's super important is that if I had a chance to go back, I would definitely pick SCNM again. I did not, like, I made a really, really great decision, and I would definitely pick it over. So that's what's important. So I wanted to add this last slide with a little bit of tips for people who are just starting the program or just looking into the program. I think that, first of all, I've learned more over these last 4 years than I ever imagined that I could have. And I've grown in ways that I didn't even know that I would. You know, one of the most important things is that when I started school, I definitely started school as like a naturopathic student. And that's how I viewed myself. Like when people asked me, I was like, oh no, I'm in naturopathic medical school. And then I think you kind of go through school a little bit and then you realize, wait, no, I know as much as anyone going through MD school, I'm in medical school. And then you get kind of closer to the end and then you realize, like, I'm actually going to be a physician in a few months. And so it grows you in ways that you didn't even know was an option, which is really amazing. On top of that, I think that you should enjoy the journey. It goes by so fast, and so you need to take the time and make sure that you're really, really enjoying it. And then some tips that I've had along the way. So you know more than you think you do. I think that as you go through school, you spend a lot of time thinking, oh my God, I know nothing. And there will be a point where you go into clinic and you know the answers and you can explain it and things like that. And it takes a while to get there, but you know a lot more than you think you do. You know, I mentioned shadowing that DO earlier, and when I did that, I shadowed with 3 MD medical students, and I definitely could keep up with their questioning, and I could definitely answer the answers that they answered. And when I left, I felt super confident in our education and really confident in my ability to be a physician. And so you hear a lot to trust the process, and you should. The next one is kind of keep an open mind. So what you like will change a million times. And when you come to school, you might have this idea that you want to do a certain modality or you want to focus on a certain population. And realistically, a lot of my friends that came into school thinking that they were going to do one thing haven't necessarily stuck with that one thing. And, you know, you might have botanical medicine one quarter and love it, and then have it the next quarter and really dislike it. And then going on further through school, you end up loving it again. So I think that you should keep an open mind. You know, for me with minor surgery, I didn't think I'd like it. And after taking the class, I actually really, really enjoy it. And so I think it's important to kind of just keep open. Learn time management. So I think this one's a little self-explanatory. You have a lot on your plate when you're in medical school, and so part of it is definitely time management and being able to prioritize what's important to you at that time. Take care of yourself. So I mentioned earlier that med school is about balance, and so having perfect grades and foregoing your health and foregoing your family and foregoing your friends doesn't really work. And so if you do that, you're going to end up burning out. So if you keep a balanced lifestyle and you realize that, you know, your priorities change at different times and kind of focus on just making sure that you're healthy, then you're going to have a better experience here. Along with that, your attitude determines your experience. So nothing's perfect. Nothing's perfect at any school. I don't think that if I went to any of the other schools, I would think that they're perfect either. But what I have realized is that if you focus on negative things, then your experience is going to be negative. Whereas if you focus on positive things and you kind of take the good with the bad and you really remain positive, then you're going to have a better experience than people who are negative will. And I wanted to finish with a quote from the COO of Facebook. she said done is better than perfect. And when you're going through med school, perfection is a completely unrealistic thing to strive for, and sometimes done is better than perfect. And when it comes down to it and you're almost graduating, I mean, it's just important that you made it through it and that you made it through it healthy and ready to go out and practice.
Wonderful. Thanks, Alex, so much for sharing that perspective. Just a reminder that we will answer questions after the presentation. So if you want to start typing in your questions, we'll be able to get to those after Guillermo's part. So let's transition to that. And again, Guillermo is a first-year student who has just started his journey. So I will be anxious to hear his presentation in 3 years and see how much he's grown along the way. But he'll be able to offer you some additional perspective on the first-year experience at SCNM. So take it away, Guillermo.
Hello, everyone. So this is a little nerve-wracking. This is the first time I've ever done this. And just to show you how amazing the school is, I don't think Eve knows what I'm talking about, what I'm going to talk about, or what I'm going to present. She just let me talk to you guys without any filters. I could sit here and just bash the school, and she wouldn't be able to control me. But I'm not going to do that because I really, really, really love the school. And I'm going to start with a little bit about me. This is an overview of my presentation. It's going to be Alex is going to be a tough act to follow because I'm pretty sure, I'm not sure how many times she's done that presentation, but it was fantastic. I was just sitting there, nodding my head and just like, yes, that's what I want to do. So the overview of the presentation is going to be divided into a little bit about me, some of the reasons that I came to SCNM, the timeline, which is very important because every time I called SCNM, that was one of the biggest questions I always had. What's my timeline? What's next? And hopefully this will give you a bigger overview, a bigger picture of how the whole process came together. My first quarter, which I thought I was prepared for medical school. Everyone told me that I was prepared for medical school, and it turns out that I was. And then my typical day, as in what I have every day when I wake up, what I'm going to do, and some of the things that I've done over my first year. And I haven't finished my first year. I'm still 2 quarters away from finishing my first year, but some of the things that I've done that have made my experience unique. So a little bit about me. I'm not sure about you guys, but I knew that I wanted to be a doctor. Ever since I was little, I wanted to become a doctor. I knew I was going to be a doctor. I wanted to take care of people, and I just needed to figure out how to get to that spot. So being a first-generation Mexican-American, I really didn't know how to become a doctor. I didn't have a path. I didn't have anyone to tell me how to become a doctor. And somehow I figured it out. And hopefully in 4 years I can be sitting here and say, oh, I'm about to graduate, or I'm a doctor. But it starts, like everyone knows, with your undergraduate. I went to the University of Central Florida. And I was doing a medical sciences degree. So I've always had my eyes set on the prize. I knew that I wanted to be a doctor. After I graduated, I needed a little bit more things to pad my resume, my curriculum. So I became an EMT, and I worked at a level 1 trauma center in Orlando, Florida, for 5 years. Between this time, my girlfriend's mom was diagnosed with cancer, and sadly she passed away about a year after she was diagnosed. So knowing how much I like research, and I started like eating up all the research about this particular type of cancer. And I don't want to get too much into that, but it turns out that it's it's correlated to a food allergy. And every time she would present that information to surgeons or to the oncologist. They would just brush it off. Because we're, in the way allopathy works, we are not very good at prevention, but I digress. So through my research, I found naturopathic medicine. And naturopathic medicine, if you guys don't know, you should read into even what Alex said about how we treat and how prevention is more important. And it made sense. It makes sense that you spend an hour with your patient rather than 15 minutes. It makes sense that you prevent. It makes sense that you try to find the obstacle to health and remove it. And only then you can achieve true curative means. So then I started shadowing a physician, an ND. And that's when I decided, yes, this is it. This is the way I want to practice. This is what I want to do. And it all just, it was a big avalanche of information, and somehow I'm sitting here talking to you guys. So the reasons I applied to SCNM. When I was researching the profession, I ended up in many websites talking about naturopathic medicine. I visited all the websites to every single one of the universities, and I requested information from all of them, all of the the colleges in the United States. And SCNM was the first one to contact me back. Well, that's, points for SCNM. And then not only did they not only sent me an email, I had actually someone call me. And I was on the phone with someone, and I had so many questions because I knew what I wanted to do. I just didn't know how to get there. One of the biggest advantages about SCNM is the NDCAS process, which is the centralized application. And so you put all your information to this application, and you can apply to multiple colleges. I ended up applying to Bridgeport and SCNM just because of that. I didn't want to have to put packets together and send it to each individual college, and it was just so much easier to have this automated, centralized application process. Another thing that SCNM did for me was they reviewed my transcripts. I sent unofficial transcripts, and someone sat with me over the phone and explained to me the classes that I needed to take, if my GPA was working for what I wanted to do. And it turns out that I qualified in every single way. So that made it so much easier rather than going into an application process not knowing if you're qualified to apply or not. I've been with my girlfriend for 10 years, or 12 years, and I knew that if I was going to move somewhere, she had to move with me. So the cost of living was very important because Phoenix is very similar to Orlando, and living in Connecticut, because that was the other college that I applied to, was probably going to be more expensive for us. I know we could have made it, but just having this, the same cost of living was very reassuring. Like Alex said, Arizona gives us the biggest scope of practice, and that's very important for career opportunities as a naturopath. But Phoenix is also, I think, the third largest market for television, which my girlfriend does television. So it was important for her to have career opportunities too. And that, so it was nice balance for both of us. I knew that I could come here, go to school and get my degree, and she was able to further her career because we have so many opportunities here in the Valley. So this is my timeline. I was an early decision applicant. I applied in October of 2012. I applied the day that NDCAS opened. They had my application, and they called me within 2 days to give me an interview day. I was able to do the whole interview process. I flew to Arizona. I was student for a day. I was sat down at a clinical rotation. And everywhere I walked in campus, everyone was smiling. Everyone kept saying hello. They recognized that I was a student for a day. They talked to me. Everyone encouraged me to come here. It was fantastic. I got accepted, and then I started my real timeline of how am I going to separate myself from Florida and come all the way to Arizona. So I continued working at the hospital until July of 2013, and that was basically my cutoff time. My girlfriend ended up working from home with the same company in Orlando, so that helped us because that gave me around a month to take care of the moving and packing and all of that crazy things that you don't think about when you're applying for medical school from a different state. From July to September, we traveled across the south of the United States. That was a lot of fun. We spent some time with family. I spent 3 weeks with her dad in South Florida, and I spent 3 weeks with my family in South Texas. So that was amazing. We drove through New Orleans. We ate all sorts of delicious food. It was amazing. It was the most relaxing time, and it was a whole 2 months of relaxation. I read a lot about natural medicine. There's 2 books specifically that I read before I started coming to school. I read Nature Doctors and Nature Cure by Henry Lindlar. And if you want to learn more about natural medicine, you should definitely read those books. Every page you turn, you will be nodding your head and saying, yes, this is the way I want to practice. I secured an apartment through Craigslist, and that was the most scary thing ever because it was all in trusting my landlord, and it turned out to be fantastic. I lived next door to school. I wouldn't recommend you guys putting your girlfriends or your significant others through that process because Craigslist can be crazy, but it worked out for me. I have a less than 3-minute walk to school. I live right next door. It's amazing. All of the people who don't live next to campus are super jealous. I ended up arriving to Tempe on September of 2013, 4 days before orientation. So I got to travel around. I went to Phoenix proper. I went to Glendale. It was a lot of fun. But if I had to do it again, I probably would have arrived at Tempe a little bit before that. This is what my first quarter was. 3 days or 4 days after I arrived in Tempe, I had orientation. And then everything was a whirlwind. Sitting down to write this list was really hard because it all meshed together. It took a while for me to make sense of it, but this is basically what it looked like. I arrived at Tempe, unpacked, and then I started school. I did orientation for the first week, and there was a lot of activities that got me closer to my class, and I wouldn't change that week for anything. That was amazing. There was a week. There's something called Natural Advantage that happens before the week of orientation, and that's a primer to get you started. It's an orientation for actual medical school. I wish I had done that. I had the opportunity to do it, but I decided to pass on it. So the people who did the Natural Advantage had a better understanding of what was expected of them for the first quarter, and I wish I had done that. So if you guys have an opportunity to do something like that, totally go ahead and do it. My first quarter is one big class. It's human biology. And in that human biology class, you cover biochemistry, you cover anatomy, you cover physiology, a little bit of endocrinology, and embryology. It's really cool because you sit down in on the classroom, and the teachers come to you, and if in physiology we're reviewing the heart, during our anatomy class, we'll start talking about the heart. And then during our embryology class, we'll talk about the development of the embryological heart. So everything meshes really well together, and it's really cool to see how things interact and how the physiology of the heart is very important and has a lot of correlations or a lot of adaptive mechanisms with the anatomy of the heart. Everything is evidence-based. We have a lot of review articles, and we have we try to keep everything on that evidence-based scope of medicine. Even though there's a lot of problems with evidence-based medicine, I'm sure you guys know, this is the system that we have, and if we want to be respected in the scientific community, we're going to have to use this evidence-based model up until something better comes around. We also had Principles of Naturopathic Medicine, or NTMD, which is one of my favorite classes. This is the philosophy of naturopathic medicine. And Dr. Nick is so knowledgeable about the way that we should be practicing and how we should be practicing. But more importantly, it's that at the end of every class, he assigns a little essay. And it can be a couple of sentences, or it can be a couple of pages. And I use that to really lay down the foundation of my philosophy of practice. And it's very therapeutic just to put your thoughts on paper and have someone else read them. I bet if I went back and I read them, I would laugh at myself because how corny or cheesy those thoughts are. But it's really nice to have that escape valve where you can really talk to someone about how you really want to practice and why naturopathic medicine is good for you. We also have something called table conference, and that's in the cadaver lab. And you have to work as a group. You get a set of questions, and it can be as simple as identify a muscle on a cadaver, or follow how would a single blood cell travel from the heart all the way to the palm of your hand. And it's really cool to put all your the information that you learn into practice and actually use the cadaver lab to really show how you are learning and how this is really how in medical school you should be applying your knowledge. We also, every Friday, we have something called team-based learning. We are assigned a couple of chapters of a book to read, and then we take a pre-test by yourself. Then you take a test with your group. And I love my group. We always come prepared. We fight like cats and dogs over answers because we all want to be perfect. But it really shows you how in a medical setting, it prepares you to defend your answers. Sometimes you will be right, and others are going to think you're wrong, or sometimes you will be completely wrong, and you'll convince your whole team that you were right. And it'll make you realize how this is a team effort and how you need to really listen to others, and more importantly, be prepared every time you come in and you take an exam or you're visiting with a patient. Our final exam, it was really cool too. It was 250 questions, and it was meant to mimic our licensing exam. So you come into class, or you come the day of the exam, and it's separated in 2 chunks, and you have to sit there and take more questions that you've ever taken before on any of the other examinations. But this is another way that SCNM is preparing us for our licensing exams. My typical day is I wake up and I have coffee. I love coffee. Prepare for class or lab. I read whatever PowerPoint presentation or articles that we need to read to be prepared for class. I have like an hour lunch. Then after my lunch, I usually you go to class and you stay in class from 1 until around 5 o'clock. After class, I go home and review the material that was covered to start preparing for the next day. I sleep as much as I can. Sometimes it's hard to find that time to sleep, but it's always good to make a routine and make sure you're sticking to that routine because it can get out of hand really fast. And how I survived my first quarter. Coffee, lots of coffee. I drink a lot of coffee. And I studied a lot. And I studied way more than I expected I needed to study. I had never studied as much as I studied for my first quarter. and it wasn't perfect. You always wish you had more time to study. If you don't have good study habits, start working on that because you will need them. I used friends to study, and I use study groups. I like to teach. I like to sit in front of people and teach what I studied. So it always helps to reinforce how you're learning all the information. I use FaceTime a lot. I use FaceTime to talk to my family. It's hard to be away from your family, and FaceTime is a free way of keeping connected. And anytime you get sad, you can go on FaceTime and you can remind yourself why you're at SCNM or whatever school you choose. My girlfriend has been very supportive. I don't know how people do it without a girlfriend. I hope everyone gets a significant other before they go to school. I know that's not possible, but I don't know what I would do without her. She knows my calendar better than me, and she is really, that's one of the biggest ways I've survived my first quarter. Sleep a lot and have fun. And this next slide, during my first year, there's some ways I've had fun. Right now, I'm trying to get back into the groove after a 2-week recess, and I've already took my midterm yesterday, my first midterm of my second quarter. So it's hard to get back into the groove, and then you're in the groove, and half of the quarter is almost over. I became a human biology tutor, so I'm helping the incoming class with tips and tactics on how to study for quizzes and how to study for midterm, and that's very rewarding, and it helps me keep all that information fresh for my examinations in the future. I discovered the wonders of physical medicine. I had a little problem with my shoulder, and during one of the free clinics, I was able to fix that, so now I'm enamored with physical medicine. I never thought I was going to like physical medicine, but it gave me such fast results that I want to learn everything that is to be about physical medicine. I went on a trip to Mexico with Naturopaths Without Borders, and using my my ability to translate, I was able to translate for, it was 8 patients in a day, and that was very rewarding. That was amazing. That's one of the clubs that SCNM offers. So I became a student ambassador because I love SCNM, and I'm almost done with my midterm week. So this has been a really crazy quarter, and I'm going to give it back to you.
Thanks, Guillermo, for sharing your perspective. And again, so grateful to both Alex and Guillermo for sharing their experiences at SCNM. And you can see already how Alex mentioned so much that you grow and you change sort of what you're interested in when you're a student. And funny to hear Guillermo already give that example with physical medicine after having just been here a quarter. So it happens quickly. All right, so we have time for a couple questions. So if you haven't already, take some time to type those in, and we'll get through as many as we can. So give me just a second to read through them. All right. So there is a question about downloading the webinar for those that are not able to stay the entire time. Yes, the webinar will be posted on our website in the next couple of weeks. So if you're not able to stay for that, that will be just fine. All right. So this question is maybe for Alex, with having a little bit more experience. Do you know of students with families, and how does that work for them?
Yes. So lots of my classmates have families. The age range at SCNM is quite broad, and so there's some people who are younger, like me, and some people that are older. I do have classmates that have young kids. I have some classmates that are single moms, so it's totally doable. I personally think it's way more doable if you have a supportive, significant other, and that can make a world of difference. But like I said, it's about balance and time management and realizing that things are not going to be perfect. And I think once you kind of let go of that idea, then you can bring in more other aspects of your life easier.
Okay, great. Thank you. We have another question about housing. Is housing available on campus? If so, how do you go about finding it? I know Guillermo shared his scary example of Craigslist. One of the things that admissions can help with is give you a list of apartments that are near campus, although we do not have campus housing because we are next door to Arizona State University, the largest university in the country. There is ample affordable student housing near campus. Guillermo mentioned that he lives right next door to campus. Alex, I know, lives about a 20-minute drive away, and that's her preference. I can let her speak to that. But we, as admissions, can help connect you with apartments, and often current students are the best resources for housing because people are always switching roommates, and they're always looking for roommates. But I'll let Alex just speak to why she prefers to be a little further away from campus.
So for me, my parents actually got a condo down here when I moved here, and so when I was looking for a place to live, being a single young girl, safety was most important in feeling like I was safe in my neighborhood. And although I think that the neighborhood next to school is safe, when I found my condo, I just fell in love with it, and so it worked out well for me. You know, I think we had a question about families earlier. I think there is a lot of ideas that go into where you're going to live. You know, when it comes to having a family, picking schools and stuff like that is important. There's a lot of different areas of the valley, and traffic is not that bad. Like, so you can live wherever you're comfortable. It's not like next door to school is the only option.
I want to add to that. Living next door to school can have disadvantages. I went, during my 2-week break, I went on a little vacation, and when I came back, I had to see the school as soon as I stepped foot into my house. So there's never a disconnect. You're always at school. Or if there's a study session, you'll sacrifice time, and you'll be like, well, I'm 2 minutes away. So you're always at school, and that can be a little bit overwhelming. If I lived a little bit further away, maybe I wouldn't go to that many reviews. So it has its ups and downs. Right now, I'm loving it. I'm not sure in 1 or 2 years if I'm going to love it as much, but it definitely has its ups and downs.
Great, thank you. Guillermo, a question for you. Somebody wanted to know the names of the books that you mentioned.
Oh, Nature Doctors. I'm not sure the author. It's a fantastic book. That's #1 in my list. That's the one that you should read. And then the second, Henry Lindlard's Nature Cure. And that's more like the philosophy of our profession. About Nature Doctors, it just shows the history of naturopathy in the United States, and it features different doctors. And every time I read about a doctor, I was like, yeah, that's it. That's how I want to be. And then I read about the next doctor, and then I changed my mind, and I wanted to be like the next doctor. So Nature Doctors, definitely.
Great, thank you. So Alex, I'll throw this question to you. There's a question about SCNM providing resources for starting a business. I will say that one of the curriculum changes that we made, and Alex talked about being in the first class of the revised curriculum, was that we made business classes as part of the curriculum to better prepare students for starting their own business. So I'll let her speak to that experience.
So the curriculum change that you just mentioned is our business classes, and they are actually really great. Like, if you are willing to put in the effort, you'll get a lot out of it. And I think that the earlier you start, the better. There's also a club on campus called Naturopreneurs, which focuses on bringing in successful doctors, you know, going and doing site visits at successful clinics, things like that, so that you can get the resources. Along with that, I worked with our one of our teachers who teaches our business class, does private, by private I mean small group business tutoring almost, where you can come up with a business. He gives you assignments and stuff like that, so I've done that. And so there are a lot of resources if you're willing to seek them out, and I think that the faster you realize that you need to do that, the better.
And the only other thing I'll add to that is that we are proud to be the first school to have a full-time career services director, and she is willing to work with students even when they're in the prospective student stage all the way to alumni. So she's always a resource to help connect current students to current doctors, although you'll find that through your classes, your shadowing, you'll have plenty of your own exposure to current MDs in the practice. but she's always counseling alum or just answering their questions about anything and everything. So we know that, you know, our commitment is to help our students be successful when they graduate. And that comes through the classes, through Joanna's support, and as Alex said, it's a strong-knit ND community, and NDs help each other with that. All right, other questions. So there's a question about whether classes are online or in-person only, and currently the program is a ground program entirely. So you do come to school in Arizona for 4 years, and classes are in person.
And to say something to that, I think that you need to have in-person classes to be able to learn to be a doctor. A lot of it is hands-on, and having the interaction with your professors and things like that is super, super, super important. I don't think that having online classes would be, you wouldn't get as much out of it.
Thank you, Alex. I'm going to transition the questions to admissions questions, especially as we're coming on the noon hour, and we want to respect all of your time. If you had additional questions that weren't answered, feel free to email me, and I'll provide you with my contact information, and we'll get them answered. And I know that Alex and Guillermo would be willing to entertain additional questions that you have as well. So let me first say there's a question here about somebody who doesn't have a science background. Should I still consider applying? Absolutely. One of the things we find is that although we're getting more students that have sort of been on this path and have done pre-med, naturopathic medicine is a very popular option for second and third career choices. So as long as you meet the basic prerequisites, and you can see those on the screen in front of you, and you have an interest and a passion for naturopathic medicine and, of course, an academic aptitude, then we absolutely consider you to apply. Guillermo mentioned that transcript evaluation, so I would encourage you to do that as your next step. Send us copies of your unofficial transcripts, and we'll do an evaluation and let you know what, if any, classes you're still missing to meet those prereqs. And then there's a question about that as far as, so when should I apply? I have some of those prereqs completed. Your admissions representative would work with you on that and help tell you if you're sort of at the right point to apply, given the classes that you've already completed, or if you need to complete some additional classes. We usually do like to see that you've completed the science class, some of your science classes before you interview, but you do not need to have all of those classes completed before you interview. There are also a couple of questions about financing your education. Alex spoke to challenges about financing your education because, remember, she is a Canadian in an American institution. So she can offer some advice about that. But I will say that 99.9% of our students take out financial aid, and financial aid does cover the entire cost of your education, including cost of living, as we don't encourage students to work. You heard from Guillermo and Alex how busy you are during the program, so that cost of living allows you to cover that so you can really focus on your education. If you have more specific questions about financial aid, I can connect you with Anna, our financial aid administrator, who works really closely with students on this. As we know, it's a very important consideration as you're making this decision. I do want to just point out a couple more things, and then again, if you have additional questions, you can email me after the presentation and we'll get those answered. Both Guillermo and Alex mentioned it. We do our application through NDCAS, which is a centralized application service. As part of that, you would need to submit 3 letters of recommendation. One should be an academic. One should be from a healthcare provider, hopefully an ND that you shadowed, or in the case of Guillermo, maybe his supervisor when he was an EMT, somebody who can speak to your interest in why you want to be a medical professional. And then the third can be from another supervisor, another academic, if you've done volunteer work, just somebody who can speak to your character. An essay, a transcript from all the schools that you attended. Of course, you need a 4-year bachelor's degree and a completion of the prerequisite coursework that you see on your screen. again, I would say the next step is send us in unofficial transcripts and we'll quickly evaluate those and let you know what, if anything, you're still missing. We do an open house twice a year called Discovery Day. The next one coming up is on Saturday, March 22nd. March is a beautiful time to come visit Arizona, so for those of you that are out of state, definitely encourage you to come out and check that out. You can take a look at the agenda online, and the link is provided there for you. But it's a really great opportunity to not only view the campus, but also hear from current students, hear from alumni, hear more about our curriculum, and just get a better sense of the profession. We have 2 tracks that day, one for prospective students and one for individuals that are interested in being patients of the medicine. So you can just hear presentations from our current doctors about various health topics. So highly encourage that. If you are not able to attend that, we still encourage you to come visit our campus and participate in what Guillermo mentioned, which was Student for a Day. And again, that's an experience where you're able to sit in on classes, shadow doctors in the medical center, and truly be a student for a day and get a glimpse of what life is like at SCNM. If you contact your admissions rep, if you've been working with somebody, or you can email me directly and we'll get you connected with somebody to sign you up for that. So I don't have the slide. I'm remiss in including it, but also check out our website to see the great things that are happening with our campus expansion. For those of you that have been following SCNM, you probably know that we are getting, well, I was going to say getting ready to break ground, but that we've broken ground. There is a building being built right behind my office windows that will be open for those students starting in fall. That will have additional classroom space, a bigger medicinary, a bigger pain clinic, a much needed cafeteria, exercise space. So really just great resources for students and the public, and really just a confirmation of the commitment of naturopathic medicine here in our community. So thank you again for joining us. Thanks again, Alex and Guillermo, for sharing your perspectives. Again, they'll be able to answer your questions if they weren't answered in this part of the webinar. So just email me. You can see my email there on the screen, and I will forward it to them, and I know that they'd be happy to respond. So thanks again for joining us. Look for information on our next webinar, but hopefully we'll see you in person at Discovery Day on Saturday, March 22nd. Thanks again, and have a wonderful day.